fruits, canned foods high in sodium. You pick up fresh fruits instead of picking up canned fruits. Any frozen meats all are high in sodium. Ketchup is high in sodium. Are we clear? Cheese is high in sodium. So remember, it's a lot of sodium in there. So your questions are not only going to be the fluid and maybe your salt, but remember the question would be your diet. And also you will see you are not giving food, Chinese food, high in salt, right? And we love it, it's good, but high in salt. There are a lot of things when you have cardiac problem, you're going to teach about cutting the salt. Next is, I want to move on number 2. Any question after coronary artery surgery? Surgery is done, the blockage is removed. Very important. What do you monitor your patient? Is line 2. I will say line 2, main wording, highlight the word cardiac unit. Patient come back in cardiac unit. Line 3, check level of consciousness. Hear the lung sounds. Even it's a cardiac, if your heart is getting congested, your lungs are going to be. Check respiratory problem. Then next line, deep breathing exercise. Very important to prevent pneumonia. Any patient after surgery. Next line, monitor temperature. What do we monitor for temperature? White blood count. White blood count is high. Patient is running fever. Surgical site, there's infection. You monitor for infection. So everyone okay? Auscultate lung sound, line 3. Then 5th line, your white blood count. And last line is discontinue any activities. If the blood pressure is dropping, a patient is not feeling good. Home care instruction. Home care instruction after cardiac surgery, limitation, 2nd line, 6 weeks, about exercise and activities. 3rd line, 6 to 8 weeks, takes about healing of the wound. And avoid crossing. Crossing is not good. Crossing legs is cutting off your circulation. And last line is elevate if the legs are good. If patient can walk around good with one block or climb over, they're okay to resume sexual activities. So it's important a little bit on your cardiac surgery. Any question? Patient is going with cardiac, your diet, you remember salt, we cut down the fluid, and cholesterol is always bad, smoking is not good. All your teaching you can apply on that. I will move on, angina. When they're saying angina, we all know is a chest pain, right? But what is another word we use for angina? CAD. I wrote it down, coronary artery disease. Coronary artery disease, CAD. Patient is admitted with a lot of time, if the patient comes, they have angina problem, but doctor don't write the order angina. What is the diagnosis is coronary artery disease. Everyone is okay? Patient is admitted with coronary artery disease. What are you monitoring? Chest pain. Are we clear? What are you monitoring patient with angina? We all know chest pain. But what is the diagnosis? Could be CAD, coronary artery disease, CAD. I want you to write down. And what is CAD is decreasing oxygen to the heart. There is not that much blockage that the muscles are not dead. What is here in angina? Remember the word lack of oxygen. And lack of oxygen to what? The cardiac muscles, your muscle. What muscles are affected in the heart? I want you to write down one word here, myocardial. And this is the strong muscle are pumping our heart. And your muscles are not getting oxygenation. Myocardium, pericardium, myocardium, endocardium. So where is the circulation is lacking here? In myocardium. And the reason could be your blockage, maybe the patient has arteries problem, but patient is not getting enough oxygenation. The muscles are not dead. In a lot of questions they said lack of oxygen, what is MI? Your myocardium muscles are, the word is ischemia. What is ischemia means? They're dead. They're not getting enough. Sometimes they use the word MI. The myocardium is dead. That means they don't have any circulation. And angina is chest pain. Both are coronary artery disease. But what is myocardium is more serious. And the problem is in the circulation. I think it's the back. Can you hear in the back? I think it's the back. Angina. How does angina pain comes? How does angina pain comes?
Left shoulder.
That's a kind of pain. But when does the pain come? On exertion and exercise. When is my pain comes in MI? On rest. Okay? So what is angina pain comes? On exercise. A stress. Not on rest. Patient is doing something. Patient is going stressful, or patient was doing some work, and lot of exertion. Everyone remember, angina pain comes on what? Exertion, exercise, and a stress. So when they give you a question, patient has angina pain, what do you give? Your answer may not be only nitroglycerin, will be rest. You got to stop what the patient is doing. So your answer is nitroglycerin, you give sublingual, we all know, 3 tablets you can give. Next line, if you will move on your page, is stop activities. What do? Stop activities. And give them oxygen and give them rest. Everyone is okay? Angina question, what do we give here? Rest and nitroglycerin and oxygen. If you pick up and they have rest and you pick up only nitroglycerin, you'll be wrong. Because you got to stop what patient is doing, exertion. Now some questions are, patient has angina pain. What is a non-therapeutic treatment without medication? Answer would be rest. Are we okay? All right, so nitroglycerin, rest, and oxygen. You don't have oxygen is okay. When does angina pain comes? On exercise or any stress. And nitroglycerin relieve the chest pain. So what kind of pain is that? A stable angina. What is unstable angina? When pain is not relieved with nitroglycerin. You give nitroglycerin and pain doesn't relieve. You're not going to say patient has anginal pain. That pain is now MI. Are we clear? Pain is not relieved with nitroglycerin or rest, is not angina. What is stable? Question. What is stable angina? Pain relieved with nitroglycerin. Pain is not relieved with rest and nitroglycerin, unstable angina. And what happened after you gave rest to the patient and you gave your nitroglycerin and patient is feeling good, that's fine. If not, patient should be in the hospital. Why? Patient is going into MI. Everyone is okay? What is word CAD? Coronary artery disease. And what did I say we are monitoring? Chest pain. What are we monitoring? Angina pain, chest pain. What is 2 things is important here? Exertion, exercise, and you must provide rest and nitroglycerin. What do you monitor before you give nitroglycerin? What do you monitor patient before you give nitroglycerin? What is the side effect of nitroglycerin? Hypotension. Write down on the side. That's another question. What do you monitor patient with nitroglycerin? Because nitroglycerin side effect is hypotension and headache. Patient complains headache. Patient's blood pressure is dropping. You gave 1 tablet and there's another question. Your blood pressure was 130/70. You're going to give 2nd tablet and now blood pressure is what? 120/60. Now next is going more down. Are you going to continue to give the medication? No. So what would be your answer? Hold the medication. So what do you check patient before we give nitroglycerin? Blood pressure. And what is non-therapeutic treatment is only rest. And you're giving rest and nitroglycerin. MI. What is MI? Is myocardial infarction. And what is the word is here? Ischemia or necrosis. What is word is necrosis? The muscles are dead. They're not getting enough oxygenation. And there's a bad blockage. Now there is a lot of sign and symptom. And I'll tell you, is pain. Chest pain is here, very heavy pain, goes towards the neck and and on the shoulder in myocardial pain. Pain is very severe. Pain is not relieved with nitroglycerin. Your patient has MI. But very important are, how do you know patient has MI? You got to do the blood test. Patient says, I had a chest pain, doesn't mean we can say patient has MI. How do we know patient has MI? Underline the lab work, CKMB. CKMB, very important for everyone to know, troponin. Now these are cardiac enzyme. Cardiac enzyme. Now what happens when the muscles are dying? These enzymes goes higher. And also they have cholesterol level is high. And when the muscles are dying, the white blood count is going high. So their white blood count is high. And triglyceride, LDH, is high. But everyone must know CKMB and troponin. What is CKMB? These are cardiac enzymes. So when the muscles are dying, cardiac enzymes are elevated in the blood. And they may not show right away. If any question, patient has a chest pain, but for 3 hours, there's nothing in the blood, you still monitor your patient with cardiac, and patient is bed rest because right away it doesn't show in the blood. Very simple for this test for you guys. But if I finish cardiac, I will take about 5 hours to finish and go in depth. But for this test, I'm touching main bases that if you have any question, you will be able to pinpoint the right answers. Are we clear? So what is cardiac enzymes are elevated in which patient? With myocardial infarction, MI. And what do you do for your patient? What is when you're not getting oxygenation to the heart and your blood is not flowing? Remember one word. I said in earlier, hypoxia is lack of oxygen. What is your first priority here? Give them oxygen. Are we clear? Patient must be in bed rest. I like it to add one word here is M-O-N-A. Morphine, they will give for chest pain. M, morphine. O, oxygen. They can give nitrates also, and aspirin. Aspirin is more as blood thinner. M-O-N-A. Morphine, oxygen, nitrate, aspirin. Just to remember a few things. But what is important for your test here, we know, is number one is you're giving is patient bed rest. Number two, you're giving oxygenation. Are we clear? And what do we give them is here is you got to open the blood vessels. Remember I said earlier the drug was streptokinase. Remember we did in the last package. And what was streptokinase is thrombolytic medication. Or they can give them heparin. What is heparin does is preventing the clot. What is streptokinase does? Opening the blockage. Are we clear? So what is the problem here? The heart is not getting oxygenation. What is the first treatment for your patient who has heart attack? Bed rest, give oxygen, and monitor the heart. They got to do the lab work. They're going to give morphine for pain, and they're giving streptokinase. And remember one thing simple. Patient has heart attack, not even giving a diet. They are going IV fluids. And when you start diet, what diet do you go on? I want just add the word soft diet and stool softener. Very important. Why? Because pushing can lead to another heart attack. So even giving a regular diet, their exercise with their eating so you want to cut down. So everyone is okay. Two things here for angina, simple word, lack of oxygen. And what is MI is necrosis or the death of the muscles of the heart. And what is the problem with the patient? They have what? Hypoxia. What happens when patient has MI? Remember the word, they're going into shock. And what is shock word is? Their blood pressure is low, their blood pressure is dropping, and pulse is going high, and respiration is high. Two words, I like it, hypoxia and shock. Because the blood pressure is dropping, the blood pressure is going normal, and patient is leading towards what kind of shock? Cardiac shock. I will be talking about the wording, the types of shock. Shock symptoms are same, but reason is the heart is not functioning and patient is going into cardiac shock. So everyone is okay, angina, nitroglycerin, everyone is okay, blood pressure we set to monitor before we give. And what do you do for your patient with angina pain? Rest. What do you monitor for MI patient? Lab work. What are the lab is here? Is called CKMB. Sometime, and I have seen in your HCCD, instead of CK, they have the word here, CMM. So it's okay, even if you see the word CMM, it's the same. So make sure you pick up that answer. Patient has MI, how do you know what lab will confirm MI? Your answer, CKMB or CMMB or troponin. Those two are very important. If you don't see in 3 hours, you still continue patient monitor with the cardiac monitor because they are going into cardiac, is into MI. And you give the medication to relieve the pain. You give them morphine, strong medication. Bed rest is important, and you're giving them is heparin or streptokinase and monitoring your patient and bringing up their blood pressure. As the blood vessels open, the circulation gets better. And if they have really a blockage bad, they may have to do the surgery, angioplasty, or maybe the cardiac surgery. But just to know the wording, MI, lab, angina, nitroglycerin. Side effect of nitroglycerin, blood pressure. Next is hypertension. I will move on a little bit the word hypertension on your question. So if you have hypertension, what is hypertension can lead to? What does hypertension lead to? What happens if somebody has hypertension? Hypertension, your blood pressure runs high. What are the biggest problem with high blood pressure? Are a stroke, CVA. Somebody said yes, CVA, yes. And so I want you, hypertension will go on orthostatic blood pressure, but your patient has hypertension, risk for CVA. What happens when you have hypertension? Where else is effect? Very good. Renal failure. What else? Eyes. What happened in the eyes? Your blood, inside the blood vessel, retinal hemorrhage can lead to bleeding. So everyone, patient says, my blood pressure is normal. I think I can stop my medication. No, we need to continue the medication. Why? You're going to say you have your blood pressure and you must control your blood pressure. Why? To prevent other organs to get damaged. And what are the organs can damage? Renal. I had a friend, she had no clue she was having a blood pressure, and by the time they found out, she had already renal failure and she has to go on dialysis. So a lot of time, sometimes you may not feel you have blood pressure. It's a very silently running your blood pressure. What is the one sign of high blood pressure you will have? Headache. Very good. Patient has headache. What do you monitor? Blood pressure. Why? Because that is one of the signs for your hypertension. Vision can be affected. Your kidneys can be affected with the hypertension. And the biggest problem is what? A stroke. I want everyone, for your exam, you know hypertension lead to a stroke and another condition, and they may ask a lot of questions. They say, which are the other patient is going on CVA, and write down the word on the side, diabetic. So I want you to remember, diabetic patient is affecting the heart, and they're raising the blood pressure, and blood pressure can lead to what? Here is the stroke. So which patient will go in stroke? Number one, hypertension. Number two, your diabetic patient. So, and hypertension controlling is important. What is the word is called in your teaching? Modified factor. What is the one? Modified factor, which we can change. Non-modified, you cannot change. But we can change, modify your living pattern. What is our modified lifestyle? Weight loss, diet, exercise. What about smoking? Yes, smoking. And so remember, your questions are, what do you teach patient here? To teach the living habits. And what else is important? Follow-up appointment. Patient says, oh, I know my blood pressure is okay, I don't go to see my doctor. Patient need further teaching. Why? Because you need to go for follow. How do the doctor would know your conditions are getting better unless you do your lab? You won't know with the blood pressure, and how do the doctor would know? They will check the urine. And what did I said in the urine word? Proteinuria is there. That means you are going in what? Renal failure. So everyone is okay. Hypertension, very important to control hypertension. And now I will go hypertension. We are giving blood pressure medication. And I said beta blockers. And I said pill medication. There are calcium channel blocker. But you must remember one thing when you are giving blood pressure medication. What does it do? Lower the blood pressure. And what is the word is called? Orthostatic hypotension. And what do you do? Number first line, check the blood pressure in 3 positions. Why? Some people, when they're taking medication, they stand up and their blood pressure goes. How do you know to prevent that? You've got to check as a nurse 3 different positions, the blood pressure. Sitting, laying down, sitting, and standing. And be careful when you're standing them up because the blood pressure can drop. Safety. So what is 3 position 2? Changing and seeing how their blood pressure runs. Second line, dangling the feet is important. Follow-up appointment, taking their medication is important to control the blood pressure. What do you cut down here? Again, salt. Are we clear? What do we cut down here? Salt in your diet. Now, I will move on cardio is circulation question. Thrombophlebitis. What is thrombophlebitis? Is inflammation. And what is thrombophlebitis comes from, and what is the sign of thrombophlebitis? You guys all remember, positive Homan sign. What is a positive Homan sign? Pain on dorsiflexion or calf pain. And doctor has ordered for SCD. What is SCD? Sequential compressive devices. If you have seen patient in the hospital, they put it on their leg and they attach it, and what does it do? Inflate and deflate, inflate and deflate. What is it improving here? Circulation. So SCD. In your question, patient says, I don't want to use SCD. Then in number 2, it says, what would you advise patient? Underline the word dorsiflexion. So let me write here a few things. To prevent your patient thrombophlebitis or before patient is going DVT, everyone should know, first answer, ambulation. Make sure you get up your patient. Don't let them sit down. But if they're on a bed rest, yes, ambulation is good. We said a stocking early, an anti-embolic stocking, and number 3, exercise. What exercise we do? Dorsiflexion. Pain on dorsiflexion, sign of Homin sign. Also SCD. Very important that your questions are prevention. So everyone knows what you will tell patient refuse SCD is patient refuses, tell the patient to do dorsiflexion. Now, that goes for your hypertension, little bit question, medication, main thing, your teaching questions can be, and thrombophlebitis for your circulation. And if you have DVT, when you have DVT, then you're not ambulating. That is before DVT. Write down DVT if you have bed rest. And you can give them is more stocking, and you can also apply warm compress. And when they have DVT, you can give them maybe your medication, heparin, or any blood thinner. So remember, now there is a clot. And when you have a clot, remember your answer is going to be bed rest. Don't massage them because you're going to be moving that clot. And do not raise the knee, always. Why? When you raise the knee, what are you cutting here? More circulation. And they use the word no knee gets. The meaning is do not raise the knee. Next is the word is rheumatic fever. What is in rheumatic fever? I will talk about it. Is the fever comes from, everyone knows, sore throat, number 1. Number 2, streptococcal infection. Any question, whether you go in peds, mostly common in the children, but rheumatic fever comes from sore throat and at their strep infection. It's a streptococcal infection. Patient is admitted with rheumatic fever. What do you ask? What did they had a week before? Maybe a sore throat, maybe throat infection. That may be one question. What do you do when your patient has rheumatic fever? Remember, I said earlier when I was talking about the heart, and I said, what does rheumatic fever damages? The heart. And so what would you do? Rest between activities. And or rheumatic heart disease. And rheumatic heart disease, I want you to write down the word mitral valve. What valve is affected here? Mitral valve. And where is the mitral valve? Right down on the side is left side of the heart between atrium and the ventricle. Those are your questions. And we all should know patient has mitral valve. And what is mitral valve? Remember, I said whenever you have valve problem, the word is called endocarditis. Same answer, endocarditis or rheumatic fever. So I'm writing like that. Rheumatic fever leads to rheumatic heart disease, which is mitral valve, and the word is endocarditis. Any question? They didn't say heart is affected. They're saying patient is admitted with rheumatic fever. What do you do? Bed rest. Why? Because the heart is involved, not because of the fever. And what do you do as a nurse? So one answer is here, bed rest. What is second answer here is rest in between activities. What is the meaning rest in between activities? Even for a nurse. You go in a patient room, you do bed making for some time, let the patient rest, go back again, give a bath, or change their clothing, and whatever you're going to do. You go in one time, well, that's your time, and I'm going to do all your care. Patient will get very tired because the blood is not flowing right way, and they are having a lot of short of breath, and they cannot do the exercise. See how your questions are? Is on endocarditis question, same answer. Rheumatic fever, bed rest. And what do you do? In between the activities, whatever patient is doing, you allow them to take rest. Endocarditis question, same thing. I want you to write down with rheumatic fever. What are the other problems they have? Mitral valve, it affects the brain. It affects the joints. The very joints are painful. And the skin. They have a lot of nodules on their skin. So remember, rheumatic fever comes from streptococcal, really bad infection. And it leads to what here is the heart problem, brain problem, and they have nodules and the joints are very painful. And how do you treat them? You give them antibiotic. What is the lab they will do here for rheumatic fever? Erythrocyte segmentation rate, ASO and ESI. If you can remember, that's okay, but immediately your question. Your patient is admitted with rheumatic fever. What did they have? History of sore throat. What do you do as a nurse? Bed rest. What are you going to treat them with? Antibiotic. But rest is very important. Why? Because the heart is damaged. And how does this infection come? From the mouth. So dental care is important for them, teaching, and let the doctor know. Any doctor they're going to visit, they must let them know they have a heart problem. So any procedure they do, what do they give them? Is prophylactic medication. What is prophylactic? Preventively. If they're going to the dentist and dentist is going to work and do the root canal and they didn't give antibiotic, that infection can damage more heart. So your questions are teaching. When you're going on dentist, make sure you let them know that you have a problem with rheumatic fever or rheumatic heart disease. Oxygen question, number 8, because it's hard, is oxygen. When you are checking oxygen, I said earlier ABG, and also you are checking is the O2 saturation. And keep a good O2 saturation. Patient is cardiac problem, circulation problem. Hypoxia word is lack of oxygen. And what is the earliest sign of hypoxia? If they ask in the question, what is the earliest sign? Nasal flaring is a respiratory distress.
Dizziness.
Clubbing of finger goes when you have, yes, it is a sign, but it's a later sign.
Dizziness.
Early sign is restlessness. All right, you all said are correct, but a little later, those comes later. So if your question is, what is your earliest sign on hypoxia? Restlessness. Everyone is okay? Patient is getting hypoxia, oxygen is not going in the brain, they become what? Restless. What is the late sign is? Cyanosis and shortness of breath, chest pain. They are getting oxygen but lack of oxygen. Now, which patient you will see, somebody said clubbing of finger, good. But which patient do you really see clubbing of finger when you're really permanently having a cyanosis? Which are the patient are first sign of clubbing of finger? Tetralogy of fallowed babies. And who else? COPD. Because that's a chronic condition. Are we clear? That's good. And it's good to think. But see how your questions can be? What do you see early sign? So if you're picking up clubbing of finger is not because of hypoxia, is coming later when somebody has what? Cyanosis. So what are you looking here? Oxygen level. You're giving your patient oxygen. And what would be your monitoring patient? Hypoxemia. What is the word hypoxemia? Very low oxygen in the blood. What test do you do when you have hypoxemia? I said in the morning, A, B, G. What do we do here? A, B, G, arterial blood gases. Patient has hypoxemia. You got to see really is oxygenation level. Now, I will go on number 9, TIA. What is TIA word? Transitional ischemic attack. What is TIA is really underlined at the end. Stroke is a mini stroke, small stroke. Patient keep on getting TIA, very small stroke. What does it lead to this stroke? A bigger stroke. What do you do? Your patient has a TIA. Question, what do you do You have a patient who has TIA. What would you monitor? Number one, yes, somebody said blood pressure. Very good. Okay, what else do you think we can monitor? Level of consciousness. That's very good. Okay, yes, level of consciousness. Okay, what else? TIA means stroke. What happened in stroke? What happened? Paralysis. Are you going to check the patient if they can move their face? Can they move their hand? What is the word when the muscles are weak? Flaccidity. Flaccid muscle. Flaccidity. Okay, flaccid word. F-L-A-C-I-D. Flaccid. It's okay. Flaccidity means the weakness. Are you going to see his patient face looks okay? What would be the problem if patient had a stroke? They cannot swallow. They cannot talk. Are we clear? So, let's see your question. And they give you, patient has TIA. What medication they can give? You guys already know. You can give them aspirin, blood thinner. You got to give the blood thinner. Maybe aspirin is your question. What do? Notify physician. Why? You want to prevent the patient going into a bigger stroke, because this is a sign this patient is risk for having a bigger stroke. So TIA question, what do you monitor here? Flaccidity, aspirin, I want you to add, monitor for a stroke, and monitor, someone said blood pressure, yes, because if blood pressures keep on going high. And which patient do you monitor level of consciousness? You guys said level of consciousness, very good. But I want to connect you. Why do you monitor level of consciousness?
For ICP.
ICP, very good. And which patient has ICP? Head injury. And what happened in CVA? Bleeding. That's why you're monitoring. Yes, you guys said very well, the right answer. But I want to connect is question with ICP. Which patient you're monitoring ICP? Your stroke patient. Which patient are you monitoring? ICP. Patient who has, somebody said, head injury. Yes. Bleeding. Yes. And what else we said here is all your questions are with, and I will be talking ICP separate. But patient had a stroke. What do you monitor stroke patient here is ICP, level of consciousness. You do monitor blood pressure. Which patient are going in a TIA and stroke? Those who have hypertension. Very important to control the blood pressure. A stroke is another thing. Then we have in TIA, highlight the word stroke. Number A, verbal communication. Check the speed and talk to them very slowly. Number B, first line airway. And second line gag reflex. And third line monitor ICP and blood pressure. So you guys said everything, and patient had mini stroke means is a stroke patient has. Let me finish few lines, then I'll give you a break, then we'll finish some more. Next is impaired physical mobility. When patient had a stroke, underline the word intracranial hemorrhage. What is stroke is? Bleeding in the brain. And any question, they didn't give patient had a stroke, but patient is admitted with intracerebral hemorrhage. What are you monitoring? ICP. Are we clear? Highlight that word. And also, second line, Glasgow Coma Scale. I will talk Glasgow Coma Scale more in neurological thing. And also, unilateral neglect. What is the meaning unilateral neglect? They don't know their weak side and their risk for fall. So remember, all your stroke patient you're monitoring for risk for fall. Let's take a break. I know you guys are feeling so